guys, what is up? Welcome back to Simplified by Gene Shah. Today we're going to do a constitution drug which is called as Carb. It is a salt made of magnesium and carbonate. Now there's a simple trick to remember this, and you have to remember a few S's, right? So when we remember a few S's, we have SAR, SOR, SCUM, sensitive, and savor or savory. When you remember these few S's, you can easily remember the drug Carb. And Carb sometimes also comes for 20 marks, so it's important for you to remember it through and through. First, let us start with SAR. We've done calcarea carb. Calcarea carb, the carb element brings in a sourness, and here similarly we see whole body will have sourness associated with it. Now when we say sourness, it could either be that the breath is sour smelling, the body is sour smelling, or the discharges are sour smelling. That's all. So this discharges includes everything. It includes eructations, it includes diarrhea, it includes vomiting. All the eructations would be sour smelling. Now when usually there is sourness, so we go back and trace the pathology that would cause sourness. And one of it, or the most common, is APD, that is acid peptic disease. Because of acid peptic diseases, there is sourness in the breath, right? There is multiple eructation which are sour smelling. So one possible cause or pathology for Carb could be ABD. Now in our materia, they also mention about symptoms of pain. Now this pain symptoms come very close to appendicitis. Okay, when I talk about appendicitis, I mean there is going to be pain. Now this pain is right iliac fossa pain. This pain is worse with food. There is satiety after little quantity of food. Okay, so the symptom is even with normal quantity of food, the person feels bloated. There is flatulence. And when he tries to eat more food, the circle would continue. He eats food, there is bloated, there is flatulence, and then again when he tries to eat, there is going to be the same thing. So the quantity of food consumed by this person would be very little. Okay, that's one thing. Now let's move on to the second S, which is SOR, which is similar sounding to SAR, but it has a very different implication. Soreness would mean, in simple terms, it means pain. So let's go to soreness. Now when do we talk about soreness? We talk about extremities. I have sore legs, I have a back pain, I have soreness in my back. So this includes extremities usually, but here in Carb it is whole body. And there is a tired feeling. It's not just pain, but it's also like I'm feeling very tired, and especially in the extremities, that is the legs and the feet. Interesting thing about this remedy is, and this we will see through and through ahead also, the person is worse with rest, and the person is better with movement. And we would compare this with Rustox as well, where there is similar soreness and the person feels better with movement, right? Since we are talking about extremities, there is another joint that is involved, that is right shoulder. Now there is also extreme pain in the right shoulder joint, and how they describe this pain as if the pain or the shoulder is dislocated. So extreme pain with the feeling of being dislocated, and pain is described as tearing pain. Now let us think about one more term that we associated with soreness, which is sore throat. Okay, now sore throat has a very specific cause or an ailment which is before menses with coryza or nose block. So if a patient persistently presents with sore throat before menses, which is also associated with some nasal symptom, you can think of McCart. So we are done with SAR and sore. Very easy so far, right? Let's move on to the sensitive aspect now. Now what do we mean by sensitivity? That means pain. When any remedy is said to be a sensitive remedy, there is going to be association of pain with it. Now here, sensitiveness in materia means both thing physical plus mental. We've already seen few aspects of physical pain and soreness, so we'll not touch upon the same thing. But when we mean sensitive, that means sometimes it is related to neuralgic pains. Neuralgic pain, as we know, would be worst with touch, change of weather, change of temperature. What we know already about McCart, how it would be worst with rest and better by moving about. Common modalities, easy to understand. Neuralgia is usually facial. So when we talk about facial neuralgia, one thing that we also have to talk about is toothache, because toothache is one of the major cause of neuralgias. Now again, we will relate this with the sore throat, that's why I've written it down, where this toothache is especially during pregnancy, and it could also be because of wisdom tooth. So neuralgic pain, which is worse with touch, change of weather, change of temperature, worse with rest, better by moving. This is the sensitive part, which includes a neuralgia and toothache, and there's one more symptom which is of headache. Now, when we always talk about neuralgia or we talk about nerves, what nerves also look like? Hair, right? So here the headache is as if hair are pulled. That's the peculiar type of headache in McCart, as if hair are pulled. It is worse with mental exertion and again better with walking. Most of the remedies, now this comes an interesting part, most of the remedies would have headache better by rest. Even in general, when you ask patients, they would say that, oh, my headache is better when I rest, when I sleep, when I'm in a dark room. That's what natrams have. But this remedy has worse with mental exertion, which is still again a common modality, but better by walking is an interesting modality, which makes it a peculiar drug. Headache is left-sided. Now we will try to see here. Headache is left-sided, shoulder joint is right-sided. Facial neuralgia is also left-sided. So sensitivity is mainly towards the left side. Although there is no such specific thing for the soreness, only shoulder joint is mentioned as right side. The throat has not mentioned any left or right side. Okay. Then we move on to scum. Scum is for the stools. There is a peculiar color to it, which is green, frothy, like scum on frog pond. And these are some interesting words to remember and to add in your answers, like scum on frog pond. It is watery. That's a typical diarrhea that this person would have, and it would not be painless. So that's an interesting point. There is tenesmus plus plus plus. It's extreme pain, which is better which is better again after moving about. Now, what is the interesting pattern here is that first of all, it is worse with milk. Now, Macarb is again a remedy you compare with calcarea carb. Secondly, Macarb is a remedy given to kids as well. So, milk aggravation in kids is a interesting symptom. If we look more in the modern day time, lactose intolerance causing diarrhea, stool, watery stool with pain in abdomen, right iliac fossa pain with acidity, lactose intolerance could be a common condition which needs Macarb. And milk passes undigested, which tells us that the body lacks enzymes to digest milk, especially in nursing children. One symptom, now whenever we talk about diarrhea, the remedies also have constipation, and there is a peculiarity about constipation as well. Now, what is the constipation of Macarb? Constipation is actually, or ailment from shock, mental shock or nervous strain. It's a very different ailment from, and you would difficult to find this also in an individual where they say that, oh, I had a very severe bad news delivered to me, post which I haven't passed stools. But that's there in Materia Medica, so we'll take it. Another interesting point which I forgot to mention about the diarrhea was that diarrhea is every 3 weeks. Which is worse by milk. Here 90% of the drug is done without you even realizing it. Let's move to the next part, which is savory, which is very easy in fact. Savory, we know it talks about food. So the person craves a certain type of food, which is meat, acids, fruits. What it wouldn't crave is, of course, milk. Savory means salty, masala, chatpat food. Now the person is not craving salty per se, but there are expectoration that are salty. So salty and bloody expectoration with tickling cough. This you can associate with the sore throat, that there is salty, bloody expectoration, right? There is aversion to milk, and that completes our SSS, and your remedy is 90% done. We'll just move on to the last part, which is female and baby. Since we mentioned that this drug can be given to females for sore throat before menses, toothache during pregnancies, there are obviously going to be other symptoms about female which are related to menses. Menses are A, scanty. You won't prescribe Macarb for somebody who has profuse flow. Then sourness translates here to acidic, which is acrid. Third, it is also dark, pitch-like. It's pretty dark menses, and they're going to be indelible. With, since we had tenesmus, there's also going to be dysmenorrhea. Now, interesting part. Now, this might be a bit difficult, so we put in a few interesting or easy modality. Flow ceases while walking. So, because she has extreme pain, it ceases while walking, and it is worse while lying down. And flow is only during the night time, which correlates with the scanty flow. So when you remember that the flow is scanty, you have to remember that it's only during the night time, right? And then we go to the baby part. Baby, we've already talked a few things, that is milk aversion. Now, common sense that if it's a small baby who's only surviving on milk but has diarrhea every 3 weeks, what is the patient going to have? There's going to be weakness of muscles, flabbiness, and tendency to marasmus. Right, that's all for Carb. That is Carb drug for you people. In case if we've missed any point, please note down it in the comment section below. Let us know how Carb is different from Calcarea Carb, if there are any thermal modalities that we've missed, and any 2 to 3 interesting points that you would like to point out between Carb and Calcarea Carb. Like, share and subscribe to the channel and send it to your friends. We'll see you again next time. Thank you.